Nastya, I want to touch on the point which scares, I know, a lot of women, is tearing. And this is something that gynecologists also quite often say, like, we don't want to avoid tearing or whatever. It's a lot of conversation about tearing. Could you explain to women what is tearing, why it is happening, how often this is happening, so they can be more well equipped about this topic?
Yeah, the tearing of the perineum during labor is actually a very common thing, especially for first-time mothers, and statistically it reduces for after. So second, third baby, your chances of tearing is reduced. Tearings can be of a different grades. It can be very small and it can be quite large and extensive. And I would say that it's a muscle overstretch. So when the baby is stretching through, I will just grab my model here, through all those, basically through this part, right? Through top part of levator ani, it has to stretch open all the way here, so the baby can pass through. It seems like it's a lot, but this is why we did all our preparation and opening and so on. And some tears, like grade 1 or 2, might happen. So usually it's either a little bit of skin, maybe a little bit of epithelial tissues, and a little bit of muscle. This is 1 between 2. Sometimes the tearings are so small they don't even require any stitches, and they just heal by themselves. Sometimes it requires just a couple of stitches, and I know many women are worried about, how it will affect them, how it will affect their continence, how it will affect their sex life. Again, from research and from my clinical experience, I can say that the grade 1 and 2 tears are very common, and if they stitched well or left by themselves, if they're small, they will not have a major effect. In most of the cases they won't. There are little things you can do. You can do a self-massage. This is why we did our preparatory massage, to get accustomed to our bodies, just to stretch it out a little bit, and after it heals, it shouldn't give you, any problems.
And if we're talking about their more maybe severe or major tearing, why again this is happening, and is there anything women can avoid? Could you elaborate on this?
Yeah, there are other 2 grades of tearing, which is 3 and 4. And again, I will just quickly grab this one. 3 and 4, it's usually because women, they will tear through the thinnest point, so it will go all the way down. And grade 4, it can be even like into anal sphincter that can, in some severe cases, create anal incontinence. Well, there are many reasons why this is happening. It can be a baby was too big and baby stuck, and the baby had to be taken out very quickly. They used the forceps delivery, the vacuum delivery, so it was just a big major trauma. Also, of course there are ways we want to minimize at least the grade of the tearing, if not the tearing itself. First of all is communication with your healthcare provider about pushing, because pushing is, as research shows, is one of the main reasons why women tear and how to avoid it. As I was skimming through the research, most of it says when you push on your side or on a 4-point kneeling, which are the gravity neutral position. So gravity does not prevent you from pushing, neither it's helping. It helps a lot avoid tearing. Deep squatting, where a woman sits like a frog and squats, it's not recommended for the first-time mothers because it can increase the tearing. Again, it's only research, but in the end of the day, it's really up to woman what she feels comfortable. Sometimes your body just drives you into this position. I believe, first of all, with your health care provider, discuss it. Discuss the positioning. Is it okay to change? What is their stance? Is there a midwife that will help you out with it? What if epidural? They say, oh, I had epidural, I have to lay down. Not necessary. Sometimes women have a very light so-called walking epidural. They can still lay down onto their side. They can still go 4-point kneeling. They can still be propped upright. Because when you lay down with your legs up, first of all, you go against gravity. Gravity doesn't help you at all. And second of all, you're compressing your coccyx, and obviously it closes the opening. So you might prolong the pushing, and therefore there will be more injury to your pelvic floor.
That's very interesting, because it looks like the most standard positions that usually doctors say, like lay down on your back, even during the examinations during the labor, it's actually counterintuitive and counter-useful for the women to give birth, right?
There is a history behind it. There is a history behind it, why it happened that, and then it's just a matter of routine and what the healthcare providers used to do. However, I'm very happy to see in my practice that the mothers, they are asking for different positions and they are getting it, because sometimes if you don't ask, you don't get it.
Yeah.
And for some healthcare providers it's a routine, but then you go and turn around and like, okay, yeah, let's try it. So make sure you discuss these things, because if you ask about it, you might well get it.